My name's Paul Yelland from Resilience First Aid Training, and today I am going to be explaining about the primary and secondary surveys that you will need to do initially when you are dealing with a casualty. So I'm approaching the casualty, I'm looking for danger, there's no danger, so I'm kneeling down, I'm having a good look at the patient, I'm looking at the position they're in, I'm looking at the colour and the general appearance. So I'm going to check for response. So I'm going to talk to them. Hello mate, can you hear me? Can you open your eyes for me? I've got no response. So I'm going to shout a bit louder. Hello, can you hear me? No response. So I'm then going to place my hands and give them a bit of a shake and a firm hold. And there's no response. So this patient is now unresponsive. So I've used the AVPU scale, alert, voice, place hands, unresponsive. So if he's unresponsive, I need to go on to A for airway. So with all unconscious patients, it's really important to maintain an open airway because the tongue can drop back and block the airway, and there could be food inside the mouth that's dropping back down into the pharynx. So we need to do a head tilt, chin lift, and gently if you suspect a spinal injury. So it's 2 fingers on the chin, and hand on the forehead, and gently lift like that. So he's sniffing the morning air, is the general saying. So that airway's open, there's nothing inside the mouth. So I've done A, I'm going to move on to B, which stands for breathing. So to assess the breathing, we look, listen and feel for up to 10 seconds for effective breaths. So I'm going to put my head down, and I'm going to count 1, 2, 3, yeah, each breath, I've got 1 good breath. Yeah, so he's breathing effectively. I can see his chest moving up and down. I can feel the breathing on the side of my face, and I can also hear the breath sounds. In the COVID situation at the moment, we wouldn't be doing getting our head down close to the patient's face. So it's just a visual assessment from way back. Okay. So he's breathing effectively, so if he's breathing effectively, he's got a pulse. So the C section is, it stands for call for help, and it can mean check for catastrophic hemorrhage. So I'm going to have a quick look around for any bleeds, and there's nothing going on here in regard to severe bleeding. So my mate's going to call for help. So as far as life-threatening situations are, there's nothing life-threatening at the moment going on, but we now need to move from the primary survey into the secondary assessment. And this is a more detailed assessment that we can do before we put the patient into the recovery position, and it might give us a few more clues as to why he is in the state he's in. So the secondary assessment is a top-to-toe survey, and it's just that. So we start at the head, and we're looking for any sort of sign as to for injuries, any clues as to what's going on. So I'm looking at his face, I'm looking at the colour of his lips, I'm looking at for trauma inside his mouth, I'm looking for fluid coming out of his nose or his ears, I'm looking at his eyes, I'm checking his pupils to make sure they're equal and the right size and reacting to light. I'm coming round, I'm looking at the structure of the jaw, making sure there's no fractures to the face. I'm checking his hairline and his skull to make sure there's no bleeding, and I regularly check to make sure there's no blood coming away on my hands. I'm checking for indentations, which would indicate a potential depressed skull fracture. I'm checking for swellings. And I'm moving down and looking at the structure of the throat to make sure there's no trauma to the trachea, and to make sure it's in alignment, any wounds. I'm looking for any abnormalities around the back on his neck, any sort of abnormal deformities. And run my fingers down. Now with the secondary assessment, we need to get down where as possible to skin level. So if it's suitable and we don't risk exposing the casualty to really cold temperatures, we can try and do what we can in regards to that. And then we expose the torso area, so we start at the collarbone to make sure that's intact, and then we go down to the chest area, so we check the sternum, and we check the integrity of the ribs. And what we're looking for with the chest, we can feel good chest rise and fall, and I'm making sure the chest wall is symmetrical and there's no unequal movement when he breathes in and out, because that can indicate a serious chest injury. That's fine, there's no wounds, no bruising, and let's move my hands down underneath his armpits, because the ribs extend underneath there and around the back. I'm just going to feel around in his lower back as well, and again I'm just moving my hands up regularly to make sure there's no blood. And now we're going to move on to the abdomen, and we're just going to palpate just to make sure it's soft and there's no wounds, there's no bruising. And I'm going to move down to the pelvic area, and we're going to do a visual inspection of the pelvis to make sure it's all intact. We don't flex the pelvis now, we leave it well alone. Okay, that's fine. We're going to move on to the upper limbs and check the arm and check the shoulder joint. And then we're going to move down, and then we're going to check the elbow and then the lower arm to make sure all the bones are intact. You can check the capillary refill on the fingernails, on the thumbnail. And that's a test where you squeeze the nail bed in for 2 seconds and then remove your finger, and you count how long it takes for the capillary bed to return back from pale to pink. So a normal fit adult or child, it should be within 2 to 3 seconds, and that's fine. And there's no need really to do it with both hands unless you suspect a fracture in one of the limbs and where the circulation could be compromised. I'm just going to move down, and then we're going to inspect the femur, and then with the top of the femur, the hip. Okay. And you can move down the long bone, check the knee, check the lower leg, the ankle, and exactly the same for the other side. Okay. And what we're looking for as well whilst we're down here, we're looking for signs of incontinence, wounds, as well as deformity in the long bones. Okay, so there's nothing really glaring obvious going on anywhere that I've checked. So at this point, we would be putting the casualty now into the recovery position. So I've moved up here again, so I've been down away from his airway for quite some time now. So I'm just going to have a quick reassess. So open the airway to make sure he's not vomited and silently choking. Okay, yeah, so he's breathing quite effectively. So what I'm going to do now, I'm going to put him into the recovery position where I'm going to stay here and monitor his airway and breathing and carry out CPR if he deteriorates and goes into cardiac arrest, and just wait for the ambulance. So that was the primary and secondary survey.